And welcome back, welcome back, welcome back. Our next guests are the CEO of CABS Health Network and the program manager of CABS Health Network's Social Care Network program. And they join us to shine a light on the premium quality healthcare services CABS offers to the most vulnerable members of our community and to speak about their 7th annual Circle of Care fundraiser gala. So please give them a warm welcome. Sherly Demosthenes-Atkinson and Khadija Harmouche. Welcome, welcome, welcome. Sherly D, can we call you Sherly D?
Of course.
It
They
sounds
call
like
me Miss
maybe a
D.
DJ name or MC. Shirley D's in the house. Here we go. Shirley D, tell us a
Woo!
little bit about the organization and what you guys do and how you got started with it.
Well, for more than 4 decades, because we started in 1980, established in 1979, but we started in 1980 providing services. So it's more than 4 decades. CABS has stood as a trusted provider of home care, which is rooted in compassion, service, and trust, helping older adults with adequate services to live safely with dignity and other vulnerable populations who suffer from chronic illnesses such as diabetes, hypertension, sickle cell, and asthma, especially pediatric asthma, which we have been addressing for more than, I would say, 7 years. Just to name a few of some of the programs that we have and the illnesses that we address at CABS.
Yeah.
But we have evolved into a full health network, providing person-centered care that meets people where they are,
Yeah.
in their homes and in their communities. Our nurses, patient navigators, and community health workers conduct visits to understand people's needs. And we expand the services beyond the home to address other social conditions. So the Bronx and other underserved areas have long
Yeah.
faced health disparities, and COVID showed us that. So our mission is to close those gaps by integrating care, coordination, and connection to help improve their social conditions.
Yeah. When you say beyond the home, would you take it to the streets?
Oh yes. We take it to community centers. We take it to libraries. We take it to legislators' offices where we want to hear from local legislators about the issues that their constituents are reporting to them.
Mm-hmm.
So that information, we get it and we determine which pockets in the neighborhoods are of the most needs.
Yeah.
And we either bring the information to them so they know that access to services is possible. So for the ones who may not feel comfortable of what those services are, have someone come into their home, we go where they are. Wherever they meet, we can be there.
All right. Khadija, what part do you play? How did you get involved?
So the part that I play, it's been in the community and talking about the social care network too, because that's something like it's the top of our services. And I see also it's like a powerful about it because I'm seeing that our mission come to life. So we have already screened over 2,000 families across New York, and through those conversations, we are uncovering real urgent needs that goes far beyond the medical
Mm-hmm.
care and directly impact people's well-being. So I have a story of a 72-year-old woman. She's a 72 who has her electricity were about to shut off. So, if you don't have electricity, what's going on? So
Yeah.
her refrigerator would not be working. And of course, she needed it to keep her food fresh. But most importantly, at that time, we find out that she needs it for her medications as well.
Ah, yes, yes.
Yes. So because of the social care network, we were able to step in, pay for the overdue utility bills. And in that moment, it became clear that this wasn't just about paying her bill, but it was about preventing a health crisis.
Yeah.
And that was like that's the heart of what we are doing at CABS,
Yeah.
making sure people have what they need to stay safe, healthy, and supported, not just in the clinic, but at home and in their everyday lives.
So you advocate for a lot of the people in our community. We appreciate that and love that about your organization and the things that you guys are doing. We
Thank
praise you.
Thank you.
Now you're introducing something brand new, the Social Care Network. Talk a little bit about that and some of the programs
I
involved
think
in that.
Yes, I think with what Khadija just mentioned about the social care network, it represents a transformational shift because with the social care network, it gives us a broader opportunity to connect healthcare with social support systems. And I want to stress that
Yeah.
because many people don't need just medical care. They need help with the essentials that sustain wellness, such as housing stability, food access, transportation, and we can provide non-medical transportation, and of course, mental health services. So for Medicaid recipients, this means equitable access,
Yeah.
as I mentioned before, to a network that listens, responds, and collaborates with other community-based organizations. So it's about building a bridge between healthcare and real life.
Yeah.
So that means addressing those social determinants that truly shapes their
Yeah.
health outcomes.
And we hear about a lot of different organizations who are providing health care access, but not much about the community care. So you guys are out there extending yourselves, and you have the major outreach and all of these different things that you mentioned before. How important is that?
Very important.
And
Go
I
ahead,
can just
Khadija.
go ahead and talk because I love to talk about the community, and when I'm there, it's something that really touched me personally. And a big part of how we are doing it is through our community innovation hubs. And these hubs aren't just physical spaces, they are trusted places where community members already go and feel safe. We are talking about places like how Ms. Demosthenes shared earlier, churches, mosques, senior centers, NYCHA developments.
Yeah.
These are spaces people know and trust. And that's where real engagements happen. For instance, this summer alone, our team community health workers engaged with over 5,000 families
Yeah.
right there in their neighborhoods. We were able to provide on the spot the social care network screening and educating them about it, like what is it, how they can benefit from it. And we were also able to direct those referrals to social services like housing, food insecurity, transportation. On top of that, we help many seniors to enroll in benefits that they didn't even know that they can qualify for.
Yeah.
It was
Right.
so amazing. And
Yeah.
it's just like talking about those deliveries
I like that. And you know, you got a lot of people
show up in the community. Yeah.
yeah, but you got a lot of people who come back and want to just be a part of what you did because you helped them. Now they want to continue with that circle of
And they
love
bring
and
friends,
continue helping
families.
others. Yeah.
They
So
bring great families.
I
Yeah.
think what I would add to that is that our model emphasizes trust, the relationship that we have built over the years. So the community trusts us, and we're also very consistent, especially when it comes to
Yeah.
populations that have been historically been overlooked. So we have been working to reframe care. So that means not just clinical services, but also advocacy. And I mentioned access and empowerment because people want to feel empowered. So to have the services at their fingertips where they can actually
Yeah.
discuss it and access it is powerful.
Well, it's a circle of love. When you're helping others get what they need out of life, it comes right back around, and it
Exactly.
shows in the organization that you guys have, just giving so much to the community. You got the circle of love. Now, talk about the circle of care awards.
Well, this is one of our most exciting time in the year because it's something we do every year.
Uh huh.
It's not just an event; it's a statement for us. We created it to honor the people and organizations who embody the values of care, equity, and innovation in New York because we service the five boroughs and Nassau County. But it's also it's a convening space. Business leaders, community partners should also see it as an opportunity to align with a movement that is reshaping health from the ground up. A few of our honorees this year, Dr. Bob, will be our silver
All
workforce.
right.
Yes, yes, we can't wait. Who are breast cancer survivors who have returned to care for their clients while in remission. So that is something to celebrate.
Yes.
So, yeah, so supporting this event means investing in a vision where healthcare and social care are seamlessly connected. So it's about celebrating what's possible when we work together and making a commitment to expand the impact even further from what we're already doing. And by the way, before Khadija jump in, because I know that she has some information to share, AT&T, who is our platinum sponsors this year,
Uh-huh.
donated $20,000
All
to
right.
yes, and I'll let Khadijah explain that because we're looking to service 500 families this
All right. We
year.
got about a minute left. Go ahead.
All right. For me, the Circle of Care Awards is more than just a celebration of where we have been, but it's
Uh-huh.
about where we are going together.
Yes.
And like how you said at the beginning, it's a fundraiser.
Uh-huh.
So this year we are aiming to raise $500,000 to sustain and scale our community innovation hubs across the five boroughs.
Uh-huh.
And I just want to say to everyone who's watching us, especially the Bronx residents and the community-based organizations, there is a place for you here with the CABS family.
Mm-hmm.
Whether you need services, you want to partner with us through our community innovation hubs, or just want to attend our gala on October 16th. So please visit our website at cabshealthnetwork.org. You can also follow us on social media at Cabs Home Care, or just please give us a call. You can call and ask about me, Khadija. We would love to hear from you.
There you
And
go.
our number is 718-388-0220.
I'm taking a picture of you guys. Put them all up there. There you go. Thank you guys so much. Khadija Harmouche, thank you so much. Program Manager, Social Network, and Connect 2. And of course, Sherly D. Sherly D's in the house. Sherly Demosthenes-Atkinson. Thank you so much.
Thank you so much
Thank
for
you for
having
joining
us.
us. And we'll see you over at the CABS Gala. That's, of
And
course.
guess what? You're hosting.
Oh, that's right. You got me hosting. Wait a minute. October the 16th. Yes, I have you on the calendar.
Yes. You'll be our MC, and we can't wait. We can't wait. And you
We'll
get to see also the great work that we're doing.
Yes. Thank you for all the wonderful work that you guys are doing and continue to do. 45 years. That's no drop in the
Yes.
bucket. You guys have been doing it. We appreciate everything that you guys are doing. You guys are
Yes.
in the community with your sleeves rolled up,
Of
doing what you do
course.
best. We
Of course.
appreciate you.
And if you don't mind, I'll just repeat the number again. Our number is 718-388 0220.
There you go. CABS Healthcare Network. Yay! All right. We appreciate you guys and love you. Thank you,
Thank you so
Sherly
much.
Demosthenes.
Love
Thank
you
you.
too. And we love the community.
Yes. All right. Thank you so much. We'll take a quick break. I've got more. It's a whole lot more open coming your way next.